Hello everyone, and welcome to the Global Interview Institute. Today I'm sharing the first 20 of our 40 most commonly asked questions in Band 5 nursing interviews across the UK, along with winning sample answers to help you stand out from other candidates. Whether you're an international nurse preparing for a virtual interview or a local candidate getting ready for a face-to-face meeting, by the end of this two-part series, you'll understand exactly what interviewers are looking for, how to structure your responses, and the specific examples that will demonstrate you're the perfect fit for a Band 5 position. So grab a notepad and let's prepare you for interview success. Introduction questions. Question 1. Tell us a little about yourself and your nursing background. Sample answer. I'm a registered nurse with 2 years of experience in my home country, having graduated from ABC University in 2021. I've worked in the emergency department for 18 months, developing skills in rapid patient assessment, IV cannulation, and trauma management. I'm passionate about providing compassionate, evidence-based care. I'm particularly interested in joining this trust because of its excellent reputation for emergency services and staff development programs. This role aligns perfectly with my goal to enhance my acute care skills in a supportive NHS environment, and I believe my experience in managing high-pressure situations would allow me to contribute effectively to your team. When you subscribe, like, and share this video, you're not just improving your career, you're changing lives. A portion of our proceeds supports vulnerable children worldwide. Act now. Be part of something meaningful. Now, let's move on to our second interview question. Question 2. Why do you want to work for the NHS, this trust in particular? Sample answer. I'm drawn to Manchester University NHS Foundation Trust because of its commitment to excellent patient care and values of respect, dignity, compassion, and inclusion. I've researched MFT's recent achievements, such as being rated outstanding for care by the CQC and your pioneering work in establishing one of the UK's first long COVID clinics. The NHS's principle of providing care based on clinical need rather than ability to pay resonates with my personal values. I believe my skills in rapid patient assessment, IV cannulation, and trauma management would allow me to contribute effectively while growing professionally in your supportive environment. I'm particularly impressed by your integrated emergency care pathway and comprehensive staff development programs, and I'm excited about the opportunity to be part of such an innovative healthcare system. Question 3. What motivated you to pursue nursing as a career? Sample answer. My journey into nursing began when, brief personal story, keep it professional. I'm drawn to nursing's unique combination of technical skills and compassionate care. What motivates me daily is making a positive impact on patients during challenging times and being their advocate. The profession's emphasis on continuous learning also appeals to me, as I'm committed to developing my knowledge throughout my career. I find tremendous satisfaction in providing evidence-based care that improves outcomes and helps patients through difficult periods in their lives. Core clinical questions. Question 4. A patient presents with severe hematemesis. What signs and symptoms would you expect to see, and how would you manage this situation? Sample answer. For severe hematemesis, I'd look for bright red or coffee ground vomit, along with signs of hypovolemia, tachycardia, hypotension, reduced capillary refill, pale, clammy skin, reduced urine output, and potentially altered consciousness. The patient might report dizziness, weakness, and anxiety. I'd prioritize ABC principles, ensuring airway patency, monitoring breathing, and supporting circulation. I'd position the patient appropriately, administer oxygen, establish large bore IV access, start fluid resuscitation, collect urgent bloods, implement continuous monitoring, calculate NEWS2 score, and urgently contact the medical team while preparing for potential blood transfusion. Question 5. How would you recognize and manage a patient with sepsis? Sample answer. I'd recognize sepsis by assessing for signs of infection plus evidence of organ dysfunction, Sepsis 3 criteria. Being alert to red flags like altered mental status, systolic BP is less than or equal to 90 mm of mercury, respiratory rate is greater than or equal to 22, or raised lactate. Subjectively, the patient might appear confused, lethargic, or report feeling extremely unwell. Upon recognizing sepsis, I'd immediately implement the sepsis 6 bundle within 1 hour. Administer oxygen, take blood cultures, give IV antibiotics, start fluid resuscitation if indicated, obtain venous lactate and blood work, and monitor urine output. I'd calculate NEWS2 score, escalate using SBAR communication, and ensure continuous monitoring while documenting all interventions and responses. Question 6. A patient with type 1 diabetes presents with signs of diabetic ketoacidosis, DKA. What symptoms would you expect, and what would be your nursing priorities? Sample answer. For DKA, I'd expect polyuria, polydipsia, nausea, vomiting, abdominal pain, and altered consciousness. Physically, I'd look for Kussmaul breathing, ketone breath odor, dehydration signs, and potentially tachycardia and hypotension indicative of hypovolemic shock in severe cases. My nursing priorities would include immediate ABC assessment, obtaining IV access and collecting relevant bloods, starting fluid replacement with 0.9% sodium chloride, administering insulin per protocol, maintaining accurate fluid balance, regular monitoring of glucose, ketones and electrolytes, and investigating potential triggers. I'd ensure continuous vital signs monitoring, especially for signs of cerebral edema, and plan for transition to subcutaneous insulin as the patient improves. Question 7. A patient has fallen and has a suspected femur fracture. How would you assess and manage this patient? Sample answer. For a suspected femoral fracture, I'd begin with an A-to-E assessment, watching for shock signs as significant blood loss can occur into the thigh. I'd observe for limb shortening, external rotation, pain, swelling, and inability to bear weight, while checking distal pulses, sensation, and movement to assess neurovascular status. My management would include immobilizing the limb, establishing IV access if needed, ensuring effective pain management before movement, arranging urgent imaging, preparing for potential surgery, implementing VTE prophylaxis, and regularly reassessing pain and neurovascular status. I'd also conduct a falls risk assessment to identify contributing factors and document all findings and interventions. Question 8. How would you manage a patient experiencing an acute asthma attack? Sample answer. For an acute asthma attack, I'd first assess severity using BTS sign guidelines, looking for inability to complete sentences, tachypnea, tachycardia, low oxygen saturations, accessory muscle use, and decreased peak flow. I'd position the patient upright to optimize respiratory effort. My immediate management would include administering high-flow oxygen, giving nebulized salbutamol, and ipratropium bromide for severe attacks, assisting with systemic corticosteroid administration, continuously monitoring vital signs, measuring peak flow before and after treatments, and establishing IV access if needed. I'd escalate to medical staff if there's inadequate response or worsening signs, while maintaining a calm, reassuring approach throughout. Values and behaviors questions. Question 9. You notice a consultant not following proper hand hygiene procedures between patient contacts. How would you handle this situation? Sample answer. Patient safety is my priority, so I'd address this tactfully but promptly. I'd find a private moment to speak with the consultant, saying something like, "Excuse me, I noticed there may have been a missed opportunity for hand hygiene. Would you like to use the hand sanitizer before we continue?" If the behavior continued, I'd escalate to my line manager and potentially to the infection prevention team, as this represents a significant safety issue. I understand speaking up can be challenging, especially to senior colleagues, but the NHS values a culture where all staff can raise concerns about patient safety regardless of hierarchy. Question 10. Describe a situation where you had to manage conflicting priorities. How did you handle it? Sample answer. In my previous role, I was caring for 4 patients when one patient suddenly deteriorated with sepsis signs, another needed time-critical medication, a third patient's family needed an update, and the fourth had just returned from a procedure requiring assessment. I prioritized using clinical urgency principles, first quickly assessing the deteriorating patient, calculating their News2 score, and escalating to the team using SBAR. I then administered the time-critical medication, before briefly speaking with the family to acknowledge their need and arrange a later update, and finally assessing the stable post-procedure patient. Throughout, I communicated clearly with all involved and requested support from colleagues when needed, which reinforced the importance of dynamic prioritization and teamwork in managing competing demands. Question 11. How do you demonstrate diversity and inclusion in your nursing practice? Sample answer. I demonstrate diversity and inclusion by recognizing each patient's unique needs influenced by their cultural background, beliefs, age, and preferences. In practice, this means ensuring accessible communication using interpreters when needed, respecting dietary preferences related to cultural practices, and being sensitive to cultural preferences regarding modesty and same-gender caregivers. With colleagues, I value diverse perspectives and avoid exclusionary language, including not using my native language around patients or colleagues who don't speak it. I engage in continuous learning about different cultures and health beliefs, approaching unfamiliar practices with respectful curiosity rather than judgment to provide truly person-centered care. Question 12. Describe a situation where you had to adapt your communication style to meet the needs of a patient or family member. Sample answer. I cared for an elderly patient with moderate dementia who became increasingly agitated during procedures. After speaking with family, I learned she was a former teacher who responded well to visual information. I adapted by using simple drawings to explain procedures, sitting at eye level, maintaining appropriate eye contact, and adjusting my tone and speaking pace. These adaptations significantly reduced her anxiety and improved cooperation, teaching me that effective communication requires flexibility and personalization rather than a one-size-fits-all approach. It also demonstrated the value of involving family to understand communication preferences and the importance of seeing behavior as communication, particularly in patients with cognitive impairments. Question 13. How do you ensure patient confidentiality and data protection in your daily practice? Sample answer. I ensure confidentiality by integrating Caldecott principles, GDPR regulations, and NMC code guidance into my practice. I'm careful about conversations in public areas, ensuring discussions about patients occur privately and positioning electronic screens to prevent unauthorized viewing. I never share login credentials, always log out from workstations, and keep paper records secure. I only access information necessary for my role, share information on a need-to-know basis, and am particularly careful with sensitive data like mental health or sexual health information. If I witness a confidentiality breach, I report it immediately through appropriate channels, recognizing that maintaining confidentiality is fundamental to patient trust and dignity. Situational, scenario questions. Question 14. A family member is upset about their relative's care and is becoming loud and aggressive on the ward. How would you manage this situation? Sample answer. I'd approach with empathy, recognizing their behavior likely stems from concern. First, I'd ensure everyone's safety, then calmly invite them to a private space to discuss their concerns. I'd acknowledge their distress. I can see you're concerned about your relative's care, and I want to understand what's happening. I'd listen actively without interruption, then summarize my understanding and provide clear information within confidentiality boundaries. For concerns I couldn't immediately address, I'd outline investigation steps and provide a specific timeframe for follow-up. If the situation couldn't be de-escalated, I'd involve my line manager while ensuring they know their concerns are being taken seriously. Throughout, I'd maintain professionalism while showing genuine concern, recognizing that illness periods are stressful for families. Question 15. A patient refuses to take their medication. How would you approach this situation? Sample answer. When a patient refuses medication, I'd respect their right to be involved in care decisions. First, I'd find a private space to discuss their concerns without pressure. I'd ask open questions to understand their specific reasons. Perhaps they're experiencing side effects, have misconceptions, or have cultural objections. Based on their concerns, I'd provide clear information about the medication's purpose and potential consequences of not taking it. I'd document the refusal accurately and inform the medical team using SBAR, possibly involving other professionals like pharmacists. Throughout, I'd maintain a respectful approach that balances patient autonomy with my duty of care, recognizing that forced treatment is rarely appropriate and usually damages therapeutic relationships. Question 16. A patient has just received a diagnosis of cancer and is visibly distressed. How would you support them? Sample answer. Supporting a patient after a cancer diagnosis requires sensitivity and empathy. I'd ensure a private environment and ask if they'd like someone present for support. I'd sit at their level, maintain appropriate eye contact, and acknowledge their distress. This must be very difficult news while validating their emotional response, whether shock, anger, or sadness. I'd use active listening, allow silence when needed, and avoid false reassurance. I'd provide clear information about next steps and available support services, offering written information they could review later. I'd ensure they have a follow-up plan and support contacts before leaving, recognizing this is just the beginning of their cancer journey and my role is to establish trust and support that will help them navigate the challenging path ahead. Question 17. You notice a medication error has occurred on your shift. What actions would you take? Sample answer. If I noticed a medication error, my first priority would be patient safety. I'd immediately assess the patient for adverse effects and implement appropriate monitoring based on the medication involved. I'd promptly inform the doctor, providing clear information about what happened, document the error accurately, and complete an incident report according to trust policy. I'd be open with the patient, explaining what happened and actions being taken, in line with duty of candor. After addressing the immediate situation, I'd reflect on how the error occurred and consider whether system factors contributed. I recognize that medication errors can happen to any healthcare professional, and a culture of transparency and learning is more effective than blame. Question 18. How would you manage your time effectively when caring for multiple patients with competing needs? Sample answer. I manage multiple patients by systematic prioritization and organization. I begin each shift by reviewing patient needs, identifying time-critical tasks and patients requiring close monitoring. I prioritize using clinical urgency principles while practicing clustering care where appropriate to minimize disruptions and improve efficiency. I communicate clearly with patients about when I'll be available and why some needs must be addressed before others. I delegate appropriately according to team members' skills and seek support early if overwhelmed rather than allowing care quality to suffer. This structured yet flexible approach helps me deliver safe care while adapting to the dynamic clinical environment. Teamwork and communication questions. Question 19. Describe a situation where you worked effectively as part of a multidisciplinary team. Sample answer. In my previous role, I cared for a patient with complex discharge needs following a stroke. They had newly diagnosed diabetes, mobility issues requiring home adaptations, and limited support. I initiated a case conference with multiple disciplines, presented the patient's status using SBAR format, and facilitated discussion when conflicting priorities emerged between expediting discharge and waiting for home adaptations. I coordinated documentation of the agreed plan with clear timeframes and served as the primary liaison between the team and patient. When equipment delivery delays occurred, I communicated promptly with affected team members to adjust the plan. This collaborative approach resulted in a well-coordinated discharge addressing all needs holistically, reinforcing that effective teamwork depends on clear communication and keeping the patient central to decisions. Question 20. How do you communicate effectively with colleagues during busy and stressful situations? Sample answer. During busy and stressful situations, I prioritize clear, concise communication using the SBAR framework to ensure essential information is conveyed efficiently. I maintain a calm demeanor even under pressure, recognizing that anxiety can be contagious within a team, and choose appropriate timing for communications while actively listening to colleagues' input. I'm not afraid to ask clarifying questions if I'm unsure about instructions, and I adapt my communication style to different situations, being more directive during emergencies while more collaborative during routine care. I take responsibility for confirming my message has been understood, using closed-loop communication in critical situations to ensure patient safety and team cohesion. In Part 2, we'll cover 20 more crucial questions about handling colleague disagreements, effective handovers, stress management, clinical governance, patient safety, and supporting patients with specific needs. Don't miss it to complete your preparation. Remember, preparation is key. Practice these answers while tailoring them to your own experience. This is Global Interview Institute signing off for now, helping healthcare professionals succeed worldwide. See you in Part 2. To be continued.